Hi, everyone. My name is Anita Osuri, and today I'll be presenting on Dengvaxia, Epidemiology and Socio-Political Impact. And my mentor was Miss Mary Patrone, who was a PhD candidate at the Yale School of Public Health. So I'm a rising 12th grader in New Jersey, and I'm looking to go into global health in the future. I'm also interested in the intersectionality between policy and science, especially in terms of ethics. When I was brainstorming my topic, I knew that I wanted to do something with epidemiology because I've always been fascinated with this. And I remember one of the first books that really got me interested in this was Small Steps, the year I got polio, which was about polio and eventually the vaccine that would be created by Jonas Salk. And now with the emergence of COVID-19, my passion was ignited even more. Since I started developing an interest in how the environment has an impact on the disease spread, I decided to do a topic about vector-borne diseases. Specifically, I was interested in learning about how it affects lower income areas, how changes in the environment, such as global warming, are affecting the spread, and also ethical implications of policymaking in this area. So currently, Dengvaxia is the only approved dengue fever vaccine, and it was deployed in the Philippines in 2016 to school children. Unfortunately, in 2017, safety concerns arose because children who were seronegative, or they also known as they never contracted dengue before, they started to have an increased chance of severe dengue after second infection. So there was a 41% to 51% chance of increased risk of being hospitalized and 41% to 62.5% increased risk of developing severe dengue. So the reason why it's so difficult to develop a vaccine for this in the first place is because there are 4 serotypes, or 4 different variations of the virus. Scientists have suspected that there are possible cross protections between these different variations, but honestly, it's really difficult to identify these exact protections. Currently, researchers are trying to create a vaccine that effectively prevents against all serotypes in a way that's convenient and also cost-effective for lower to middle income countries, which is where dengue is usually the most common. Another difficulty is that dengue is spread by mosquitoes, so the year and the time of year outbreak could affect the spread of it. And also the age of the patient and also serology of the patient would also affect that. Here's a graph I made using my maps from Google and Google Docs, which details the population of each of the 17 Filipino regions. And this might be useful to compare population size and amount of dengue cases. And just to show another one of the graphs that I created, this shows the heterogeneity of dengue outbreak size in different regions of the Philippines. And really, it shows the multitude of factors involved, which could lead to regions having contrary case numbers. So as seen here, like CAR, in 2014, it had a lot of cases, but then the year after, it decreased so much. And so it just shows that these different regions, even though they're in the same country, they could have vastly different numbers. So the main impact of the Dengvaxia vaccine was the ethical implications of vaccinating 800,000 children with an unproven vaccine. Almost 10% of the children vaccinated were at increased risk of severe dengue, and some of them did pass away. So understandably, this was broadcasted on social media and television, leading to a lot of false news being spread. So the government was charged, but ultimately they were not convicted. Currently, the European Union and US FDA have issued a license for Dengvaxia to be given to seropositive individuals. So just to review, seropositive, they have contracted dengue before. So the issue though is that this serological testing, or to see if people have contracted dengue or have the dengue antibodies, it's really expensive and it's not always available, especially in these lower to middle income countries. Scientists have also been concerned of the long-term effects that vaccinated seronegative children might face. And this raises the question of what really is the responsibility of the WHO versus local governmental bodies, because some people have said that the WHO hasn't done enough in making sure this is really a feasible plan. And other people said that they've done enough and it's not really their job to do that. Meanwhile, it's like local governmental bodies' jobs to do that. Overall, I concluded that vaccine management is crucial and we should continuously check up on these vaccinated children, especially the seronegative ones, and put funding into developing other vaccines as this is still a real need. And lastly, research into other dengue control methods. These other dengue control methods include the Wolbachia bacteria method to make the dengue fever virus unable to spread through mosquito populations, which could reduce the incidence of the virus along with a feasible vaccine. And that's a whole nother topic that I was also pretty interested in, and I encourage you to look into. So relating to COVID-19, the similarities between this situation in the Philippines and also our current situation where I am in the US, it's really fascinating to look into. Vaccine hesitancy was on the rise after this Dengvaxia controversy, and also it's still on the rise even during COVID. So I suggested working alongside local leaders and developing educational campaigns to regain the trust of the people. And for faster detection of the virus, I suggested a possible rapid antigen test similar to the one used for COVID. Writing this research paper and working under the guidance of a mentor was an experience unlike any I've done before. I gained the confidence to work with data and not be afraid of it, but rather learn how to use it to bolster my points. It also taught me that science isn't always perfect. And as seen by this ongoing situation, science is continuously evolving and we can take many lessons learned from the past and apply it to future situations. I found that there are many uncertainties and questions that are still left unanswered based on my research, and it inspired me to continue exploring these intersectional topics of biology, policy, and ethics. So I'd like to thank my mentor, Ms. Mary Patron, for supporting me through this process and beyond. It was truly through her mentorship that I gained confidence in research, and her support propelled me to continue wanting to do research in this area. Also, her suggestions were so valuable to improving my scientific writing, as I can relate to Anushka that my science writing, I did have some experience, but it definitely wasn't college level. And also, Mary helped me learn how to think differently about these global issues. I'd also like to give thanks to my primary officer, Ms. Akshita, and Nora, and the rest of the Talaria team for pairing me with Mary and being very encouraging through this process. Lastly, thanks to all of you for listening in. I really appreciate it. And these are my references.